Hello, everybody, wherever you are in the world. I would like to speak to you today about self-help and self-organization of drug users as an important source for solving drug and drug policy-related problems. Um, I'm doing this with the help and the support of my colleagues, Dr. Ingo Ilja Michels, who did the basic report on that, and Dirk Scheffer from Deutsche AIDS-Hilfe. Ingo and me, we are working at the Frankfurt University of Applied Sciences in Frankfurt in Germany for many years, and we are conducting the SOLID project, the project where the summer school is integrated, or the October 2020 school is integrated. We both, and we all three do have long-term experiences in self-help and self-organization in the founding of such organizations, but also in the conducting of these organizations. For Germany, and I confine my presentation on Germany, we had some very early responses to the HIV/AIDS crisis in Germany already in the 80s. You see here a picture of a part of my hometown, Bremen, in the north of Germany. What we did from 1987, 5 years after the HIV virus spread in Germany, and we were quite sure that it spread not only among gay men, but also among drug users and some other people, sex worker, for instance. 5 years after we got to know that this happened in our communities, in our cities, we installed so-called needle and syringe automats like that. First of all, in my city with 600,000 inhabitants almost, we have 5 of these slot machines. Until now, there are 3. So you can see here it's a 24/7 accessibility and availability of clean needles and syringes. And this automat and this, let's say, concept has been copied in 120 cities in Germany. And all in all, we do have some 200 of these automats in Germany. And people who use drugs can choose a lot of material out of these automats, either needles and syringes, or only needles or only syringes, condoms, and some drug use paraphernalia, which are very important to have in order to do a hygienic and safer use consumption of illicit drugs, mostly opioids or cocaine. Also in Germany, we do have the condom automats. There are thousands or 10,000s of them in mostly in restaurants and male toilets, but also 24/7 accessible in the community. So both, let's say, both responses to the needs to protect from HIV have been developed in Germany, and we got a figure for these needle and syringe automats. Some 500,000 packages are taken out of these automats per year, multiplied with 4, because there are mostly 2 needles and 2 syringes in that. It is quite a substantial contribution to the protection of HIV, of intravenous drug users. And also condoms are freely available via openly accessible 24/7 automats or restaurants, wherever. And also the protection of the transmission route, sexual transmission, is quite easily possible. So people in need of needles and syringes and condoms do have a wide variety of opportunities to get these materials. In a recent study we carried out for the state in Germany with the highest population, in North Rhine-Westphalia, we saw that these needles and syringe automats, they have a varying contribution to the HIV protection and a varying contribution to the number of needles and syringes provided to drug users. In some big cities, they do not have a very big share or a very big contribution to the whole number, the total number of injection equipment given out. But in small villages or in smaller cities, these automats do play a major role because apart from pharmacies where you can buy, of course, needles and syringes and condoms legally, apart from pharmacies, these automats do play an essential role in the 24/7 access to clean needles and syringes. So until now, these two ways are quite developed and form the basis for a good and early response to the HIV crisis. In the beginning of the HIV crisis in Germany, we saw that the epidemiological situation showed an increasing trend in the percentage of drug users, especially among the total registered HIV and AIDS cases, like in many other European countries as well. Regarding the prevalence of HIV infection among drug users, studies showed a range from 20 to 60% of drug users being positive. And that was quite alarming for many ways, for many institutions. So they financed also NGOs, but also drug service institutions who changed the way of working in the direction of harm reduction. But also newly upcoming so-called AIDS-Hilfe, AIDS services organizations were built up as a network throughout of Germany. And they had both in mind, let's say, an individual prevention to support people in need of means of protection by giving out the material, plus a structural prevention and health policy initiatives. That means that they were also busy on the local, but also on the not only municipal, but also on the federal level in order to change the frame and the conditions in which AIDS services or drug services could be delivered. And that was the AIDS service organizations. They were the ones coming into the field quite newly from 1982, 1983 onwards. And now some 140 service organizations throughout Germany, mostly in the bigger cities, are there and help people to get along with the means of protection and counseling and access to treatment, apart from the access to protecting means for these people. But also on the structural prevention level and health policy initiatives, they were very busy and they were very successful indeed. So without these AIDS services, some legal changes would not have been possible, or at least not been possible in that short period of time. However, it took almost 10 years from 1982, where we got to know that HIV drug users are part of the HIV AIDS crisis. Apart from 1982, 1983, up to 1992, it took 10 years, more or less, that in the German opium law, a change has been made that the provision of sterile syringes and needles was made legal. So in many cities, this was kept in a gray area, in a legal gray area. The Federal Association of Pharmacists went against that for 2 years. They said, we are allowing people, we are giving people an occasion to use illicit drugs, so we stopped giving out needles and syringes. But with a clarification in the German Opium Law 1992, this has been changed. And one of the key drivers in this legal change were the AIDS service organizations throughout Germany. So they came into the game 1983, around that. And they were not, let's say, kept, or they were not restricted by other professional discussions on delivering an opportunity or giving out an occasion to use syringes. For them, the main goal was the stop of HIV and AIDS. And people could get rid of drugs with other means, but first of all, they had to survive and not to get infected. And everything else could be at the second place. And that was very, that pushed German drug services quite a lot, and pushed also the changes in the opium law. And they were these AIDS service organizations in Germany, and some drug services organizations, some drug counseling institutions. They were quite clear about the fact that the effectiveness of a purely rational approach is quite limited. That means that giving out some leaflets or giving out good counseling is not, let's say, leading necessarily into a behavioral change. But it needs a little bit more giving out the protective means in order to protect oneself from the risks of infection. And that means that safer sex or safer use or safer work for sex workers, that were not, this was not discussed under moral auspices, but they were not moral questions. But they needed to talk about these issues in a very clear and directive way. And also, fear, shock, and isolation do not increase risk awareness and do not lead to a change in behavior. So within the whole HIV development and within the HIV crisis, what has been left and what has been achieved in many ways is the acceptance of certain lifestyles, knowledge of and empathy with one's own social, cultural, and sexual identity. That was needed, that was made very clear, and especially the movement of gay men and lesbian women has gained a lot from that. I think the HIV and AIDS crisis made the acceptance for different lifestyles, for different sexual identities, the understanding of different sexual identities much more clearer than it would have been done with other means. So it would have taken definitely more years and decades to get this acceptance done. Now, when it comes to the implementation of harm reduction in Germany, we see a long-standing discussion around medication-assisted treatment, or so-called opiate substitution treatment, OST, with different medications. It took more or less 10 years from the first discussion until, let's say, the implementation in a pilot project, 1986. We discussed a lot. There were very controversial positions from the denial and opponents of the introduction of methadone treatment or opiate substitution treatment to the implementation in 1986 in North Rhine-Westphalia in a pilot project. The main constraints in these discussions were done by the traditional drug services. They were the most heaviest opponents, and they said that once people are given out the medications, they would not attend drug counseling institutions, and they would not get rid of their dependence to opioids. And some pictures were given out into the round that the doctors were called the dealer in white, that those who were giving out methadone were thought of as the complices of addiction, and with the whole concept of medication-assisted treatment, they associated, let's say, a capitulation before the addiction. So it took quite a while, and in comparison with most of our European neighbor countries, like Austria or Netherlands, France, for instance, they were very much ahead, and it took very essential years in which we couldn't manage to introduce opiate substitution treatment. And since 1987, it started, but I would say it took another 8 to 10 years until opiate substitution treatment covered a lot of needs and in the target population. Now, more than 30 years ahead, we have approximately 80,000 patients in opiate substitution treatment. That is supposed to be 50% coverage rate. 50% of all estimated opiate users receive either methadone, buprenorphine, slow-release morphine, or diacetyl morphine called heroin from the doctors, with a wide variety throughout Germany, from north to south, from west to east. There is a huge variety. Some regions do more, and in some regions, opiate substitution treatment is not seen as the key response, although the Federal Chambers of Doctors regards methadone treatment as the key intervention for doctors once they see an opioid-dependent patient. So the same accounts for medication-assisted treatment in prisons. Also here we have a huge variety. And when we see the coverage rate outside in the community and freedom is 50%, inside prison it's supposed to be 15 to 20%. So prisoners do not benefit from the progress of addiction medicine. So they still are in a waiting position on waiting lists and do not receive the treatment they should receive. In 1992, I mentioned already, the German narcotic law was changed in order to allow for the regular supply of sterile equipment as an HIV/AIDS preventive measure. And a few years later, the other changes have been made. But as you see, it took really long time, and you have to have a long breath in order to change things substantially. When it comes to prison and needle and syringe exchange, we see in Germany that only one prison out of approximately 180 prisons, one prison is providing prisoners with clean syringes and clean sterile needles. And that is still a pity and a black box, because also lots of energies from NGOs, from self-help groups, self-organization groups, but also from many other institutions, we have demanded for quite a while to bring in needle and syringe exchange schemes also in prison. German opium law again has been changed and amended, and by the year 2000, after the example of in Switzerland, drug consumption rooms have been legalized. By now we do have approximately 24 rooms in only 8 out of the 16 Länder, the federal states of Germany. So you can see, again, this is still controversial after all these years, that only half of the German Länder did, let's say, issue a regulation in order to allow the cities to introduce and to open drug consumption rooms. And the other 8 did do this regulation. We've got 24 rooms. In some parts, in some hotspots like Frankfurt on the Main, we have 4 consumption rooms. And my institute is monitoring the development and the movement in these for consumption rooms, and we are counting here approximately 200,000 consumption events annually, and approximately 4,500 people are using and utilizing these rooms for injecting their drugs they bring with them. And there's hardly, in the last 10 years, there was one overdose, fatal overdose case, which has not been clarified even until now because of corona vulnerability before. But taking only Frankfurt, we see that these consumption rooms do play a major role for social work in many ways, and for the clients, of course. Around these consumption rooms, we do count approximately 400 emergency cases, either in these rooms or outside, where social workers are called to do reanimation. And then none of these emergency cases, except one in the last 10 years with millions of drug consumption events, died. So these consumption rooms do play a major role in helping people to survive and to get into contact with drug users on a daily basis. And from the drug consumption rooms, bridges can be built into the traditional higher threshold drug service structure, for instance, into detoxification systems and so on. So the philosophy of harm reduction has been implemented in Germany since the early 90s. It is now a pillar, apart from counseling, treating, and repression. It's the fourth pillar of drug policy in each and every municipality, city, and also on the federal level. It is seen as an inevitable contribution and part of the whole drug service.